Hi, I'm Dr. Brian Thornburg, and I'm finally understanding the confusion around the vitamin K injection or oral vitamin K and vaccines. I've heard parents reference the vitamin K shot as a vaccine. It is not a vaccine. It is vitamin K. It's just a vitamin. And it's injected because vitamin K does not transport across the placenta to the baby from mom to baby very well. This is purposeful because we don't want to have the baby or the mom in a hypercoagulable state, which means an ability to have more clots. We don't want to have a baby who's going to have a birth which can be traumatic, easily form clots. That's something that should happen after delivery because of that higher risk kind of birthing process. Babies have lower levels of vitamin K on purpose. It doesn't transport across the placenta well. And we do need vitamin K to help us clot. It's part of the cascade of clotting kind of steps so we can stop bleeding if we cut ourselves, and we do cut ourselves obviously on our skin. We have micro traumas inside of our blood vessels, also newborns, especially premature newborns. The junctions between the arteries and the veins are not that tight yet. They're still being developed, so there's easy bleeding at these junctions. And so we want to make sure when the baby comes out that they can adequately clot. And if we do not administer the injectable vitamin K or the oral vitamin K, then there is a higher incidence of unnecessary bleeding. The unnecessary kind of bleeding can happen early, the first day of life. It can happen just in the classic form, which is going to be the second day of life through the end of the first week. And then you have a late form, which happens at that 3-week out to a couple months, where there can be bleeding. And each of these kinds of bleeding periods can locate in different parts of the body because of the vulnerabilities at that time. But if we give oral vitamin K by injection or orally, then you decrease the incidence. So the incidence without oral vitamin K is 1 to 2 babies per 100 live births. So that's 1 to 2% of all live births can have one of these types of bleeding. So that's why I always advocate whenever a parent asks me who comes into my practice, should I skip that? And part of the misconception that I'm learning is they think it's a vaccine. It is not a vaccine. It is just vitamins. The injectable form has a black box warning in the physician's desk reference manual, which is the Bible for physicians on pharmaceuticals. However, that black box warning that it can cause sudden death is for vitamin K injected through an IV and not from injection into a muscle like we do with the newborn babies. So there is a black box warning. It does not specifically highlight which form of delivery of the vitamin this references, but I have learned over the years that it's about the injectable into the IV and not the injectable into muscle. So given the 1 to 2% chance that your baby could have a bleeding problem, injure their brain, worst place, we don't want to risk it over a vitamin. I do advocate for oral vitamin K. Why give a needle stick to a newborn baby? It's absolutely unnecessary. But the important part, if you do oral vitamin K, it is not just one dose like the injection. It is 12 doses, 1 dose a week for 12 weeks. So you have to be a very responsible and diligent and observant parent to take the oral PAP. So again, vitamin K injection is not a vaccine. Parents are confusing that, and that's why there might be some of this hesitancy to give injectable vitamin K or vitamin K at all. It is not a vaccine. The vaccines are hepatitis B, which is also offered to newborn babies. I do not recommend hepatitis B for a baby unless the mom tests positive for hepatitis B. The arguments that they will provide, even if mom is negative on her serology against hepatitis B, the arguments that you'll hear is, well, what if the lab made an error? Well, I discount that because we can't work in a world where we don't trust the labs that we're taking unless you have good reason to mistrust it. Otherwise, we should trust the lab. 2, what if mom has AIDS and she can't mount an antibody response? That is real. I have seen that happen in an adoption with HIV testing negative. So it's very real that it could happen with hepatitis B. This was an adoption situation. The adoption was from a high-risk mom who was an IV drug user. And unfortunately, mom had overwhelming AIDS, couldn't mount an antibody response. And the baby then was tested positive for HIV but then many months later did test positive for HIV. There are some caveats here. You might also hear that hepatitis B should be given because what if mom is a prostitute or dad goes and sleeps with a prostitute and then sleeps with mom? These are very, very pigeonholed, low statistic probabilities, very, very rare. So I have to put things into a common sense perspective, and that is, if it's so rare, we don't need to mass vaccinate all newborns. They should be vaccinated at a time where there's going to be maximum effectiveness to the vaccine, to the hepatitis B vaccine, and that would be in the teenage years, early teenage years, because we know if the vaccine is administered, it has approximately a 50% year shelf life of about 10 years, which means 50% of those kids who receive the vaccine at birth don't have an ability to mount a response after they're 10 years old. So there's low efficiency for giving the vaccine at birth for really no valid reason other than to have you as a parent surrender your child to the medical establishment and to give a vaccine the first day of life and have you feel that the only way your child can stay safe is by injecting an unnecessary vaccine into them. So, I have a lot of issues with that, but hopefully this clarifies some of the confusions about vaccines and vitamin K and the necessity for vitamin K. And thanks, as always, for watching.